Our next delegation is here in person. Natalie Smith is also speaking with respect to the environment for policing in Winnipeg, report number 9. You have 10 minutes, Natalie.
Thank you, Natalie, and welcome to the board meeting this morning.
Good morning. Good morning to His Worship Mayor Gillingham, Board Chair Chambers, and Police Chief Smythe, and of course, all board members. My name is Natalie Smith, and I'm here today to speak to the 2022 report, The Environment for Policing in Winnipeg, recently published by the Winnipeg Police Board. I'm speaking to you today as a resident of the North End, a community that is severely affected by the state of policing in our city. I'm concerned that this report is being considered as a framework for strategy by our police board. This is not a value-free summary of a proper environmental scan of Winnipeg. There's no work cited, there's no methodology or reasons given why certain items were of note while others were not. There are also sections where the police clearly provide rebuttals to statements, not research findings, so I'm not sure how this report can be considered objective. This is unfortunately a trend we are seeing with not only the police service, but the police board. This is not a document that inspires trust. I believe that the contents of this report are representative of a police board who is looking to defend and shield Winnipeg police from criticism and are not presented in good faith or with accountability in mind. I have highlighted several areas of this report that I would like to specifically address to this delegate in my delegation. First, on page 6, we have a whopping 40 words explaining defunding. No work cited, no research findings, no explanation of the calls to action. And I'll read it here, and I quote, "There are still a number of proponents of police abolition movement, including defund police. This point of view does not include any plan for managing the calls for service from residents of Winnipeg that police must respond to," end quote. As you may know, I was a council candidate for the Monarski ward in the most recent municipal election, and part of my platform was a call for a 10% decrease over 4 years in the Winnipeg police budget. While campaigning, I spoke to many residents who supported my platform on defunding, folks who are completely outside any abolition movements. In fact, in the 2022 citizen survey that the Winnipeg Police Service put out, the belief that our police are overfunded increased from 9% in 2019 to 19% in 2022. This is a response to a statement about funding, not abolition, and growth in numbers shows that these calls for defunding are not only from abolitionist groups, but a growing understanding that our unsustainable police budget is impacting our entire city. The statement, and I quote, "This point of view does not include any plan for managing calls for service," unquote, is an excellent example of why this report is not sufficient. Delegates have volunteered their time and expertise to present to this Winnipeg Police Board, the City Council, over and over again on alternatives to policing and defunding models. The Police Accountability Coalition has released quite a bit of research and recommendations through the Social Planning Council of Winnipeg. In fact, in May of this year, they published the 2022 Alternative Municipal Budget, wherein they recommended that the city implement the CAHOOTS model that started in Eugene, Oregon in 1989. Is there a reason that this information was neglected from your report? That's definitely a question I have. My second point, similar to my previous point, on page 9, we get a very brief section on funding models. Again, no work cited, no examples of other models to consider. Just reference to the 2021 public engagement campaign where participants were presented with only 5 models of police funding, none of which address the calls to defund and reallocate to community services. This is a tactic one only uses if they refuse to engage in good faith. You cannot consult on defunding models while refusing to consider them as an option at the same time. The report contains no mention of feedback or critique of this campaign, which was noteworthy enough to be reported by the CBC. Because the options presented, those in support of defunding felt forced to vote for the status quo, even though the survey results also noted that reduced police funding was the most frequently written in comment in the open-ended survey comments. Any framework used for strategic planning by the police board needs to be transparent. This section, again, shows that there is information deliberately being left out. And this brings me to my third issue. On page 3, the report attempts to explain the lack of trust in police, referring to it as, quote, anti-authority feelings, unquote, without examining the effectiveness of police. On the campaign trail, I spoke to numerous citizens about their experiences with the Winnipeg Police Services. I heard numerous stories about people placing calls to 911, about break-ins on their property actively occurring, only to be told that no one was available for this call. Residents have been told by 911 operators trying to scare off their home invaders themselves. I heard personally from people whose garages were ransacked, had video footage to pass along to the police, only to be told, we can't do anything with that footage. So nowhere in this report are the readily available stats that can help illustrate why our city has lost faith in our police. In that 2022 citizen survey I mentioned earlier, it shows that respondents increasingly feel that police do not do a satisfactory job or respond to calls in a timely manner. It also shows that citizens are making more complaints, over 50% of which were very dissatisfied with the outcome. Data from the Winnipeg Police Service 2021 annual report tells us that the police only have a clearance rate of 1 in 10 in property crimes. This data is valuable in explaining why there is an increasing lack of public trust. Let me present a metaphor. If your cell phone never worked, but your phone provider kept increasing the cost of your bill with promises of improvement, but you still can't get reception, would you still trust that phone provider? Why should residents of Winnipeg be asked to provide more tax dollars when this one department takes nearly 30% of the entire city budget? Why should we be expected to pay more money to a department that is very clearly broken? Winnipeggers are tired of all this money going into reactive department and want to invest in the prevention of crime. Items like housing the homeless, helping addicts get into treatment, and providing people with their basic needs to ensure that people don't have to steal just to eat. The call for defunding is rational and logical. A city service with this much failure should not be continuously rewarded with the increases of funding. That is unheard of anywhere else in social services. What I am asking of you as the police board is to understand that many Winnipeggers are fed up with the failures of our city to listen to us residents. If you are concerned about the public distrust of the Winnipeg Police Service, then I urge you to reconsider this report as a strategic framework and actually examine the many recommendations offered to you, such as the calls to action published by the Police Accountability Coalition back in 2020. So finally, I'd like to ask where the following statement on page 12 of this report comes from. Quote, a report from one province indicated that safe injection sites did not reduce overall overdose deaths or opioid-related emergency calls, and they led to an increase in crime, discarded needles, and social disorder in the surrounding neighborhoods, unquote. Again, there is no source, there is no indication of which province this is, and there's nothing to back this statement up. And since this report neglects to mention any data or recommendations from local Manitoba Harm Reduction Network, I assume that they too have not been considered in writing it. At this time, I'd like to thank you for your time, and I would just like to extend a welcome. I'm available to any of you for any conversations or email correspondence moving forward. I thank you and have a great rest of your meeting.
Thank you. Don't go away. Just we could ask some questions. Are they Mayor Gillingham? Please.
Through you, Mr. Chair, thank you. Thank you, Natalie, for your comments. I was taking some notes here. So I'm just to improve future reports. You asked for some work cited. Again, the last quote that you read out of page 12.
Page 12, yeah.
So just looking for work cited. I think you noted also the report in your view would be made stronger if other data and other surveys were included. I've got those as two major things in your view to improve the report. Was there anything else I've missed just to improve the quality of the report from your standpoint?
Yeah, I mean, the main thing would be if we can engage more with, especially with our local organizations who are doing really great work and have a lot of data and spend a lot of time researching these things. I think that would be really important. And you're right, like the works cited for reports, I think is very crucial. You know, many people who have attended university, and we know that that's, you know, item number one when writing a report is you have to make sure that, you know, people can check that your work, right? So those are important things.
Thank you.
Thank you.
Any other questions? Just again, you talked about the CAHOOTS model from Oregon. You're aware that the city of Winnipeg has a complementary type of program, ARC, that was initiated about a year ago. just at the
I'm
beginning?
familiar with ARC. Yeah.
Okay, as well as EPIC, the emergency paramedics and community that provide medical support to individuals in distress.
Mhm.
What is more significant about the cahoots model? And I'll even go one further. We've got ARC, we've got EPIC, and we've also got the Downtown Community Safety Partnership that and Bear Clan and a few others are out there providing supports in the community proactively. So how would that vary or be different than the Coots model in Oregon, based on the research that I've done that provides all of these agencies that we have as a similar model to Cahoots?
Well, I think one of the big concerns is at least the way that the ARC is set up in particular. I can speak to that one because I'm familiar with that one especially. This money is going through the police service with the police service guiding it. And it's not that's necessarily a bad thing, but the concern is when we're talking about how to provide service that is both outstanding, but also not terribly costly. We have to understand that, anytime we do things through the police, because of the collective agreement, anyone who's doing that work in the policing is doing it at a much higher cost than it would cost, medical professionals, rather, say like a mental health professional who is trained in de-escalation and trauma support. So we have to look at, the police doesn't need to lead everything. The police have enough on their plate, to be frank, and we need to have more organizations that are being led by medical research, by doctors, by social workers, and things like that, and getting around the police. And I think that that's very important, because we can provide more funding to the police for ARC and things like that. But at the end of the day, if I'm someone who's having a crisis, and I know that it's still a police officer, whether or not they're in uniform, and I have bad experiences with those police officers, I'm not going to respond very well. I'm in crisis, right? So we have to look at trying to figure out ways to complement what's happening in our police service with trying to reduce costs, but still maintaining proper levels of service.
Well, and thank you for that. Are you aware that in terms of the ARC program, it is funded by police currently? It's not through police, it's by police. They were the ones that hired the clinician to attend to the call. So
no, I understand that, but they still have control over that program. And that still is concerning because, for example, I mentioned early on in my delegation, as a North End resident, the way that the police treat residents of the North End is a lot different than they treat people in St. Norbert. I mean, that's a fact. Unfortunately, it is. We see numerous police cruisers literally, whipping through our neighborhoods. We have police helicopter overhead. I don't know, I did it. We're not here. But the police helicopter is constantly, over us. And so there is a very significant lack of trust of the police in the North End. And so anything that is police led is always going to have that concern from residents. And you can't build trust until the police are willing to come to the table and offer the community solutions that are actually, engaged with the community.
have you had the opportunity to review the crime map that's available online? And do you see or pull down any of the data that's available in terms of where the calls for service are primarily received from?
No, I'm aware that there are more calls in the North End, but that's because of
Downtown and North.
Well, downtown North End, sorry. But that's because of underlying issues. And the only thing that the city is doing is funding the police instead of funding things like getting our homeless off the street, feeding people. Well, there was a story in the CBC yesterday that 1 in 4 Manitobans who are working, who are getting paid, are having to go to the food bank. So the city needs to do a lot more to meet people's basic needs. I mean, if you're concerned about anti-authoritarianism, the thing you have to do is understand that many people, their basic needs aren't being met. And it's very easy for those people to get swept up into far-right movements. So if the city is concerned about fighting crime, we have to prevent crime ahead of time by providing the things that people need.
And my last question, and thank you for the response, but in terms of individuals in our city and the needs that are there, do you think it's only the municipal government that's responsible, or are other levels of government responsible as well?
You know,
especially from a mental health, addictions, homelessness, poverty perspective.
I am well aware of the different levels of government. I even know that municipalities aren't even in our constitution. But the fact of the matter is that municipalities are facing the brunt of these issues, and the municipalities have to do something. It's not easy, and this is something I talked about in my campaign. But our levels of government need to work more in lockstep, and there needs to be more coalition building of, there's lots of counselors, I'm sure, in your shoes and other cities who are dealing with these same issues. It's important for municipalities to really make it really clear that these are issues affecting our city, and until our cities do anything about it, and whether that's reliant on the province or the federal government, the cities still need to do something. It's not easy, like I mentioned, but it is really important that that this is affecting us on a daily basis.
And just lastly, earlier in the month of November, the three of us here, our vice chair and Colleen, board member Colleen Mayer, we attended a national policing conference in Vancouver. Our vice chair and I, on one of the days, was sitting in a room with other board members from across BC and Alberta, and up north at Whitehorse, I believe it was. And the person sitting beside us she had a double master's degree in nursing, and she was sharing with us the safe supply that in Delta, BC, I believe it was Delta, BC, or in Vancouver, somewhere in Vancouver, that their LPNs offer safe supply. They'll actually carry the safe supply to individuals. I asked the question whether or not it actually reduced the amount of overdose deaths as a result. And her response was not to the extent that initial data models had indicated. But it's also created unintended consequences in it that the LPNs that are delivering the safe supply are now being targeted for their safe supply. So nurses that are trained to not only deliver the safe supply, but to monitor the individual while they're using or consuming, are being targeted for their safe supply, not by the individuals necessarily that are using, but by other individuals that are seeking to profit from that, because now they have a safe supply that they can sell. So in terms of, and Mr. Sharfstein can verify that in the sense that that was the conversation, and it really led to further conversation about what is the trade-off here in terms of, and yes, we want to reduce deaths. We want to ensure that, it is that gateway where if a person does want to start to turn their life around and remove drugs from the equation, that at least they have somebody to talk to. But we have to look at what that trade-off is and whether or not it is that balance where we can start to get people not using anymore and taking responsibility in terms of their lives. So that's just something I wanted.
No, and that's fair. But I also would like to, mention that, well, two things. One, an anecdote isn't substantial evidence, but number two, and I think that this is very important, is that, there are ways to mitigate that, but the most important thing about safe supply is it ensures that we can curb overdose deaths, but the most important thing about safe supply is that we can build trust with the users, which will open them up to more treatment options. And that's the most important part. We know that people are using drugs, and people will continue using drugs. What we need to do is ensure that they can do it in a manner that they are treated with respect, so that they both understand that they are not a parasite on society, but also that there are options for them to get the help that they need. And so, it's a part of a much broader collective movement. It's not just the one safe injection site is needed, or, it's one piece of a quilt that's really important to connect people back into their community. So, thank you.
All right. Well, thank you very much.
Thank you. Thank you for your time.
All right. Thank you.